So we're here again from the World Association of Infant Mental Health Congress in Rome, and I'm joined by Dr. Rebecca Pillai Riddell, who is the director of the WAIMH Lab in the Department of Psychology in York University in Toronto, and she is joining us today to speak a little bit about her work and her research in the WAIMH Lab.
So today's talk was about how we can integrate infant mental health screening in well baby visits. And what I see as a really important missed opportunity is watching the behaviors of a mother or a father when they're addressing the infant's distress after a vaccination needle. And so here we have in a vaccination context or in a needle context where we have an unambiguous situation. We have an infant who is in high distress from a physically painful procedure, and we have an opportunity multiple times over the first few years of life. Often in Canada, we do it at 2, 4, 6, 12, 15, 18, and 24 months of age. So we have the same opportunity to keep watching how the dyad reacts in this high distress situation. And in our research, so we learned from the WAIMH cohort. So the WAIMH cohort is the Opportunities to Understand Childhood Hurt Laboratories cohort, which followed caregivers and infants in the largest cohort of its kind in the world. And we were able to follow 760 families. And when we were watching, we were able to code over 2,000 vaccination appointments, watching these families over the first year of life. We were able to look at and realize that the 3 minutes after an infant gets a needle, that last needle, was very predictive of the dyad, of how they were functioning. And I think the reason is that I see pain as an attachment context, as would Bowlby and everybody else who would see an infant in high distress that requires regulation. The infant isn't capable of soothing their own pain, and they depend on their caregiver. So what we were able to find, we actually took 2 approaches to it. First, we looked at sensitivity, which was more traditional route. And what we found is that while parental sensitivity was predictive of how children learned to regulate from distress and how they approached even the vaccination context before they got needles, what was even more telling was how insensitive were these behaviors that were reflective of insensitivity. And while I would never say that our Ouchie tools, we created the WAIMH Labs inoculation evaluation, I would never say that it's a diagnostic tool. What it does is it takes the temperature. And so what we were able to do from looking back at our tapes in a paper that's coming out in the Canadian Journal of Pain with myself and my graduate student, Hannah Gannis, as co-first authors, is we were able to look at the validation of a checklist of 8 behaviors that we designed with a team of vaccinating nurses and pediatricians in addition to a team of researchers. And so we all worked together to really try and find a way that you could actually just watch. As you're participating, you've just given the vaccination, to look at 8 behaviors that may suggest that the dyad is in trouble. And I know that this is a trauma-interested audience, and one of the things where trauma can really show up is when how a parent will approach an infant's distress and how they respond to that, because it can be a high trigger to be in a situation to see an infant crying at high distress, which happens after vaccination. So we had 8 behaviors, and I won't say them all here, but what they had to do with a lot of them was looking at the parent's face. So how did they react to the infant's vaccination? And so we looked at whether they had flat responses, whether they were fearful. Did they say that they were scared? Were they exacerbating the infant's distress? Or were they frustrated? Could they be angry? And so we called that sort of the parent face cluster of behaviors. We had another set of behaviors that were just inappropriate in the vaccination context, or not necessarily vaccination, but specifically the high distress context, because all of these behaviors were the parent's response to the child in high distress. Because any of these behaviors may not be so predictive if it was in a non-high distress context. So their infant is crying, and then we see, for example, a parent putting their hand over the infant's face. So they're trying to block the crying. They're almost at a loss for how to soothe the infant, so they put their hand over their face. And then it's also an opportunity to really just look at whether the parent was forceful, for example. So the idea of like pulling a baby across the examining table by their arm. So that's just a sampling of the behaviors that we describe in the Ouchie, in our article coming out this year in the Canadian Journal of Pain. And what it does, again, what we feel it represents is it's a move forward for immunizing or vaccinating professionals to be able to start taking a temperature of how that dyad is functioning by just looking at the behaviors. So it doesn't really take a lot of extra time. When we've worked with pediatricians kind of trying to practice, we've seen that it takes about 30 seconds to fill out once they're used to the measure, and they're doing it as the vaccination is occurring, so it doesn't really take a lot of time at all. Thank you.
Thank you, Rebecca. That's really important work, and I think hugely important for our maternal child health nurses in Victoria, who similarly have an amazing opportunity doing these 10 key ages and stages visits across the first 3.5 years of life, from birth right through to the preschool period. And I think your work really highlights the importance of bringing the relational into the primary healthcare setting that these nurses are working in. So we really value your work, and thanks so much for sharing it with us today.
My pleasure.